Hi, this is Amanda Lane. This is task 6, discussing some of the physiological parameters that we monitor during surgery. Also, some of the reflexes that are present during certain stages of anesthesia, and then also we'll be talking about the stages of anesthesia and what the animal goes through and how you can kind of tell when they're going from one to the other. So to start, some of the physiological parameters that we monitor heart rate. So a lot of the parameters that we monitor can be used with this SurgiVet. It's a multi-parameter monitor, so it gets a heart rate. We have an ECG, so that will help us with heart rate and heart rhythm, so we can check for any arrhythmias, any other abnormalities. You want to check for AV heart blocks, PVCs, anything that looks abnormal is recorded on this machine, and we are able to know that that is happening, alert the veterinarian, and be able to either reverse that with medications and or wake the patient up if we can't get it corrected, for sure. So definitely want a strong, nice strong heartbeat, nice strong rhythm. You want good P waves, solid QRS complexes, and good T waves. So anything abnormal is reported. Definitely, this monitor also monitors the patient's CO2, so how much carbon dioxide this patient is exhaling. And then it also, in this same section, it does record the respiration rate, so you know what's happening, and it gives a nice waveform going down when the patient breathes in, and then when it's exhaling the carbon dioxide, it humps up. So you can follow that and monitor that, make sure that seems normal, and with that, with checking the respiratory rate, not only are you monitoring here, but you're physically looking at your patient, watching the rise and fall. Make sure that you want them taking nice deep breaths during certain stages of anesthesia. They might be panting or hyperventilating. So you want to kind of watch out for that. We also monitor oxygen saturation. So so by doing that, you can kind of tell how they're oxygenating and how they're ventilating by their mucous membrane. So you can flip their lip, and you'll be able to check the color. The color, you want it to definitely be a nice healthy pink. Anything pale, white, definitely blue, not good. They're not oxygenating very well. The way to check, another way to check the perfusion is capillary refill time, and you can do that just by taking your finger, pressing it up against the gum. It will blanch for a moment, and then the return time, the refill time should be less than 2 seconds, 1 second, and that's kind of alerting you how the blood is, how the body is perfusing and getting blood and oxygen to all of the tissues. So you definitely want to keep up on that, and and then next. This also records the blood pressure, so you want to monitor blood pressure. This will do systolic, diastolic, and mean, and it records that, which is kind of nice to have all of those readings, so you really know what their actual blood pressure is like. And you obviously we don't want any of our patients to become hypotensive or hypertensive. There are ways of combating that, but you certainly want to stay on top of it, so that hopefully none of those things happen. And then we are always monitoring their temperature. You can do it with this machine. I have found that it doesn't seem to be as accurate as just using a thermometer and checking it every 5 minutes. So always wanting to do that. We do record that as well, so that we're making sure that they're not getting too cold. We definitely don't want any hypothermia or hyperthermia, we want to keep them at a nice normal. So nice normal temperature for surgery at 97 to 100 degrees Fahrenheit is good. We also here use a breathing rewarming unit, so it helps the little guy stay a little bit warmer. Let's see, and then what we'll do is all of this information that is being recorded on the SurgiVet, it is recorded into one full summation of everything, and it just gives all of the patient information. It records by minute the anesthetic agent, the O2, and then down here I have graphs of all of them individually, but it breaks it all down. The ECG, the SpO2, the oxygen saturation, the blood pressure, systolic, diastolic, and mean, the end-tidal CO2, and then the respiratory rate. So everything is really, really nicely put here in one chart. And then I've got little breakdowns of each. So this is breaking it down and recording it every 5 minutes, so we know exactly how that patient is doing. So this kind of just breaks it down for the entire procedure. This was a dentistry, so it was a little long, but it breaks it down by graph as well, so you can actually have a big picture of how they were doing exactly. This is the ECG, so we can kind of see there's a little waves here, but everything was relatively normal for this dog's procedure. We've got our SpO2 and so on and so forth, our end-tidal CO2 and blood pressure. So everything is recorded in their record, and it's just very important that you're monitoring that. You can use all of these machines, but you definitely need to just keep your eyes on your patient at all times. In addition to all of this, make sure you have a stethoscope so that you are able to listen to the heart rate manually and just make sure that everything is making sense. As for so another part of anesthesia is the reflexes that certain animals will have. One of the reflexes is the ear flicking, and what you can do for that is take your finger or a pen or something and just lightly run it down the pinna, the fur of the pinna, and if there is a little flicking motion, that patient is pretty light. You can see that in stage 3 light anesthesia still, so that's not into the surgical plane of anesthesia yet. So that's one of the reflexes. Another one to test kind of depth is the pedal response. So what you can do is take your fingers or an instrument, and you can actually pinch between the toes or a pad with a pretty good pinch, and if that animal withdraws their limb, then you know that they are feeling that stimulus, and they are not at a surgical level of anesthesia yet. Another reflex is the palpebral. So what you can do is just lightly take your finger and tap either at the medial or the lateral canthus, and if there's a blinking response, then you know that that patient is still aware, not in a surgical plane. There's also another reflex, the corneal reflex, where you can take sterile saline or artificial tears, something like that, and introduce that to the cornea, and the eye would kind of roll back. You can also do that by applying pressure with your finger to the upper lid and seeing if the eye kind of rolls back. Another good indicator is jaw tone. So what you typically would do is you would just take your hands and try to kind of not pry open, but open the jaws. If you're getting and meeting a lot of resistance, then that patient is probably not quite ready for a surgical procedure. There is another reflex, the swallow or laryngeal reflex. It is you can find it in two different times during intubation, when you start to introduce the tube and the epiglottis slams closed. mostly as a protective mechanism, but you can just kind of see the patient start to swallow. Also, it's a good indicator when a patient is ready to be extubated. They'll start to see the swallowing at the ventral neck, and that's a good indicator that it is a safe time to go ahead and remove the tube. Another reflex would be the position of the eyes. So when the patient is in a good state of surgical anesthesia, their eyes go from a central location to a ventral medial. So excuse me, it ends up looking like you can see just the sclera, and it ends up looking like they're looking sort of down towards their chin or neck, and that is a good indicator that they're getting deeper. There is another reflex that involves their breathing pattern. It may or may not be as effective because there's so many different times where their their respiratory rate increases and decreases. It may not be indicative exactly of their anesthetic depth. So it's always good just to kind of be aware of all of the stages of anesthesia and what you're supposed to be looking for. There are 4 stages of anesthesia. The first stage 1 is the animal will start to lose consciousness. Some voluntary things will kind of go away. They'll lose the ability to stand on their own, and they'll kind of slide down to the floor. And then as they're moving from stage 1 to stage 2, they're in stage 2, it's also known as the excitement stage, and they can have some struggling, fighting the drugs, some paddling, some fear, and that will, as they're moving from stage 2 to stage 3, that will kind of subside. They can, in stage 2, their respiratory, their circulatory, their nervous system, everything's kind of on alert, and so they start to settle down, and they get into stage 3. Stage 3 is broken into 4 different planes. So now, versus some textbooks say 3 planes, but there are 4. So the light stage 3, their heart rate can be increased, their respiratory rate can be increased, they are losing consciousness. They're progressing, from light into medium. Stage 1 is the lighter of stage 3, and then stage 2 is a really good surgical plane of anesthesia. That's where you want to keep them. If they progress too far and they get into the plane 3, it's kind of getting them sort of dangerously close to being too deep into anesthesia. They consider that excessively deep. Which unfortunately kind of can get them closer to stage 4 of anesthesia, which is a medical emergency. They can stop breathing, their heart can stop, and they can pass away. So you always want to just make sure that you are monitoring everything about your patients so that you know exactly where they are, what they need, what they don't need, so that you can make sure that a stage 4 surgical anesthesia doesn't happen. And they recover smoothly. Thank you.